Wellness Friday with Sakra World Hospital.
Wellness Fridays continues in association with Sakra World Hospital. Sacral neuromodulation is our theme for this week. The second week running, the Dr. Alok Mohan Uppar, consultant neurosurgery at Sakra, has joined us. Doc, you did say that patients test the therapy before committing to full implantation, and then there's a full implantation. What kind of improvement can patients realistically expect, and is the improvement immediate, or does it take a few days?
Okay, so what kind of improvement? It's there for us to see. Typically, patients come with overactive bladder or urge incontinence. So we see that they are able to have a good continence or able to control their urinary problems or problems of incontinence. They're able to reach the toilet comfortably. They are not going to have any other symptoms which results in a social embarrassment or things like that. This can actually be seen immediately after the placement of the trial leads. So the trial period usually lasts for about 5 to 7 days after implantation. Within those 5 to 7 days, patients usually get a good hang of what they are going to see or what benefits they are seeing. So it is going to be a yes or no kind of a situation usually, where patients say, yes, I'm satisfied with this result and I go forward for the final placement. The patient himself or herself says that he's happy. Now, this is with respect to incontinence or an urge incontinence. Sometimes you also have retention. So in these patients of retention, where they're not able to void urine, they probably have to resort to mechanisms of self-intermittent catheterization. To every time they have to pass urine, they have to pass a small tube through their organs to let the urine out. So that's quite a difficult situation for somebody. So in this scenario, the checkpoints or the assessment criterion are a bit different compared to incontinence. So in these patients where they have to catheterize themselves daily, let's say they have to do 4 times to empty their bladder. Suppose there is a 50% improvement that they have to do it only twice a day, and the other 2 times they are able to do it on their own. They're able to pass urine on their own. There's a 50% improvement in their symptom. And we also do something known as post-voidal residues. Let's say that earlier a patient was able to, pass only 200 ml of urine. And now with this procedure, if the patient is able to pass about 400 ml of urine in one go, or the residues in the bladder are, decreased by less than or more than 50%, then we say that it is responded well. And even these patients are considered positive, and we do offer final bladder replacement in these patients also. In simple words, in one set of patients with incontinence, they say, yes, I'm happy with the continent. And in other set of patients with retention, we look for objective improvements like 4 times a day of catheterization decreases to about once or twice a day. And the amount of urine they pass increases by more than 50%. And the residual urine in the bladder decreases by about 50%. So that's all we look at in patients of retention.
Just around the corner, I'm going to ask Doctor if the device will be visible at all from outside the body. Stay with us on this excellent program, which is brought to you by Sakra World Hospital. Wellness Fridays, and to check out more, it's the Sakra mobile app that you have to go to, or the sakraworldhospital.com, sakraworldhospital.com. I'm Rishi K. Stay with us on 94.3 Radio 1.